Bismillah ar-Rahman ar-Rahim. We have a proverb in Arabic which says, "Is'al al-mujarrab wa la tas'al al-tabib." So Professor Talbot demonstrated this, which means ask the experience, but don't ask a doctor. You excelled in demonstrating what mild, moderate, and severe Alzheimer's disease means. So I'm going to be talking about dementia. So my objectives are facts on dementia in UAE, symptoms and signs of dementia. Professor Talbot explained this in great detail, so I don't have to explore more on it. What helps can we seek? So someone who has dementia, where they should go. And the system, what a UAE system provides to help dementia people. So dementia. Dementia is a disease of the patient himself and the family. So it's in contrary to heart disease and diabetes, right? The patient with heart disease themselves, they suffer from it. But people with dementia, the patient and the family struggle, or you can, in contrary, enjoy dealing with a demented patient. So, dementia in UAE. Okay. So, we are a premature country. We don't have we have low prevalent dementia people. Why? Because we are mostly younger population. But I bet you, in 20 or 30 years' time, because the 30 or 40-year-old people will become 50s and 60s, and they have diabetes, high blood pressure, and those people will get Alzheimer's disease. So imagine the X number of 30s becomes 60 in 30 years' time, they will have dementia. So they will need a dedicated center for these people. We are very good in building buildings. We are very good in building airports. We have big scientific centers. We need parallel ideas on treating dementia people as well. Okay, so why dementia is important and why it's affecting the elderly people? So, but statistically, we know that, that 25% of those above 75, they will get dementia, some sort of dementia. 50% of those above 85, they have some sort of dementia. So that's a large number, right? So if you don't die of car accident, diabetes, heart disease, you will suffer from dementia. You will die from dementia. As Professor Talbot explained, that by 2015, the number of dementia or Alzheimer's dementia patients will exponentially increase in numbers. What services we have in UAE? Well, it's still premature. We don't have a dedicated center to deal with dementia patients. We have an advantage of being 7 emirates, but as a head of department, I cannot collect all the dementia patients in UAE. Number one, I have political reason. I mean, I have to go to Sheikh Khalifa Hospital and ask the head of department over there, how many dementia patients you have. You have to ask ethical committee approval. I have to ask committee approval in my Emirates. and the other Emirates. So that's politically not possible to unify all those. But this will be possible because we tried it on many other specialties. As we've mentioned, we don't have dedicated centers for dementia. Well, I could tell you we have 70 neurologists here in UAE. But is anyone interested to do dementia and anyone to deal with dementia? You have Dr. Iyad? Okay. Okay. Because no one wants to spend 1.5 an hour dealing with dementia patient. And many mental state exams to examine a patient with dementia takes hours and hours to do. We have, and I studied in Toronto, we had Baycrest behavioral neurology examination. It took 3 or 4 hours for me to do this exam. So no one is willing to be involved in dementia patients. So everyone is running away from it. So that's how to encourage ourselves to deal with dementia. That's a challenge as well. That's number one, encouraging neurologists to do it. Number two, dementia is a multidisciplinary service. So people with dementia have diabetes, they have high blood pressure, so you have to deal. Studies proved that if you're treating blood pressure, diabetes, cholesterol tightly, you can delay the progression of dementia, or you can delay the onset of dementia as well. So you need to involve medical, you need to involve neurologists, you need to involve geriatrician, you need to involve psychologists, and the core should be family and the patient. Okay. Well, we are opposing home care service, but we can incorporate this in the home itself. So we can teach family members how to deal with dementia patients. And as I mentioned here, you don't find many people in 60s and 70s with dementia, but as you increase in age, the numbers of dementia increases. And that's statistic made by WHO. As I mentioned, the prevalence of Alzheimer's disease or dementia overall is strictly age-dependent. So where we lie here, because we are a younger population country. We are in the yellow zone, which means we are a low prevalent area. But countries like States, Scandinavian, Europe, they have higher percentage of elderly people, and they have higher percentage of dementia. I bet you in 20 or 30 years' time, we will reach on their level. So we have to face this concept, whether we want it or not. We have to have dedicated center. Well, why dementia is important? You can tell, well, they are elderly. I mean, they will die anyway. Well, they are elderly. They will die anyway. But I saw a nice sign. I couldn't get it, and it was in Toronto where I studied. A picture of an elderly, and a sign behind it, or below it, say, "They build the country. Please don't forget us." So this sentence affected me. So as they built the country, they took care of us. We should take care of them. That's a time where we should take care of them. And on top of this, is, the #1 cause of death among the more prevalent diseases. I mean, you have heart disease, we have diseases respiratory. #1 cause of death in the whole population is dementia. People of dementia, they get heart disease. They can have pain, they cannot tell. They will just scream. They can fall, they can't tell. They can't remember that they fell. Okay? So they will cost the society, they will cost themselves and the family. So if you don't take care of them earlier on, the society will struggle and we will struggle. So not to scare you, what is dementia, or what's Alzheimer's disease? This is a normal brain on the left side. Where is the marker here? Is there a marker? This one? Oh, sorry. This is the one, okay. So this is a healthy brain. So you see, the best example my supervisor was giving, as you get aged, you get gray hair, your skin will change, you will get rougher skin. Your brain will change as well. So that's the nature. That's the penalty you pay when you get aged. So the brain will age. So where is the center of the memory? So that's the place we call it hippocampus. So that's where we'll get earlier changes. So this is a center that's responsible for new memory. So whatever memory you get now recently, you will remember it. Why? Because you have a healthy hippocampus. So why people with Alzheimer's disease get recent memory changes? Because this gets affected earlier on. They will tell me, the family will come and tell me, my dad will remember, or my mother will remember exactly what happened 20 years ago, but he or she will not remember what happened 2 minutes ago. The reason is obvious, because the new learning area is affected earlier on. These areas will get affected later on when the patient gets severe Alzheimer's disease. And there where you get the language affected and the whole personality affected, and even the mobility will get affected. So that's a complicated slide just to illustrate where hippocampus is. That's a center where you get new memories. This is the cortex, where you have the language center and the personality center. So if you affect this area, which is when it's severe Alzheimer, your language center and your remote memory will get affected as well. So what happens earlier on, in earlier stages, just to summarize, you have forgetfulness, recent memory problem, orientation, attention problem. When you get the outer area gets affected, you get language center problem. Then you affect your personality and mobility as well, and later stages. So what happens in, that's that slide maybe. So what happens in dementia, your brain gets shrunk. So some of the function of the brain will get affected. So as Professor Talbot mentioned, can we prevent from Alzheimer's disease or dementia? Yes, there are modifiable risk factors which you can prevent or can treat, or we can even delay the progression of dementia. Number one cause in UAE for disease is approximately 25 or 30% of all UAE people or population have diabetes. And that's an alarming sign. Huh? That's number one cause of later early onset dementia. I see patients who are 60s, 65s. I rarely see 60s, 65s in UAE or in Toronto with dementia. I see 80s, 90s with dementia. But here, 60s, 65s with dementia. Why? This is number one cause. So you can modify or you can delay the onset of dementia by treating all this. Blood pressure, we are the most obese. We are more obese than the United States population. We are more obese than the most obese people in the world. We are more obese than Native Americans even. Multiple trauma to the head, of course, as a common cause for headache. And the best example for this is Muhammad Ali. Smoking as well is a modifiable risk. So if someone's having memory problem and smokes, please tell them not to smoke. And it would modulate or delay the progression of dementia. There are non-modifiable risk factors. We cannot avoid having those. So being a female, unfortunately, is a higher risk for having dementia. The older you are, of course, you get more prone to get dementia. Environmental factors. Why I mention this? Because there are certain population they found in Scotland where they were having a lot of aluminum in water. These populations were more prone to get dementia. The amount of food, I mean, Mediterranean food, it's well known to protect you from having dementia. Sorry. If you have low IQ to begin with, of course, you are more prone to have dementia. It's well known that uneducated patients are more prone to get dementia than educated people. People who work, my dad is almost 80. I encourage him to go to work. Go and work there. And he loves to work. He loves to go to his place. That would promote activating his brain. It will keep his brain highly active. You have tonic activation of the brain. And studies showed, actually, if you keep your job, keep studying, keep writing, you are progressing or delaying the progression of dementia, or you're delaying the onset of dementia even. Of course, smoking, I put it in modifiable and non-modifiable as well, because people who smoke, they always smoke. Okay, Professor Talbot explained this in great detail, so I don't have to touch it, but I could tell you briefly, what are the 10 signs of dementia? So anyone has a family member with dementia or had a family member with dementia, raise their hand. Okay? So most, 80% of the audience have family member of dementia. Me too. Okay, so what are the 10 signs? I don't have to recite it for you, but one of them is memory problem which affects the daily living. So someone who has memory problem, who always had memory problem, is not affecting his activities daily living. I wouldn't call it dementia, right? So some function should be impaired and should affect the activities of daily living, affect the society or the family member or themselves. That's a sign of dementia. You can be working. What happens early onset of dementia is people who work, their job performance gets deteriorated. So that's the earliest sign. Someone who's not working, the personality gets changed. Some people with dementia, they get shy. So they try to avoid their family members or their friends. So these are the 10 signs. I don't want to recite it for you because you explained it in great detail. Okay, so what can we do to take care of the dementia patient? We had an experience in stroke in Rashid Hospital. We had an experience in multiple sclerosis. I think we're going to have a dedicated center in a few years should we provide this strategy. I believe Mira and the group is starting this by having the awareness and education about what is dementia. You can put these slides, the 10 signs of dementia, these simple ones, put it everywhere, and educate the people. Teach them that diabetes is not just treating it's not only treating diabetes, you can treat complications from diabetes. You can prevent a big thing like dementia. So awareness number one. I think we reached a great deal with education and awareness, at least in Abu Dhabi. We are trying to do it in Dubai as well. Well, the next step would be, we have neurologists, we have geriatricians, we have medical, we have social workers, we have psychologists, but we need to put them all in one area, in one dedicated center. Encourage the professionals to be involved in this disease. So that's step number two. We have, I think in Dubai Health Authority, we have a shy, small memory clinic in peripheral health. We call it a memory center, but I'm ashamed to call it a memory center because we don't have, simply they don't have neurologists over there. So what should we do? So that would be next step. So awareness, step one. I would expect it to take a few months, six months to 12 months. The dedicated center combining multidisciplinary centers or multidisciplinary specialists would involve mainly those specialties. Will take another 6 to 12 months, I believe. And having a society or a home care center for those people. I know as a UAE culture, we don't accept throwing your mom or your dad to a home center. But I liked the Canadian way. They made a home center close to the parents' home with the dad and mom together. And the family are close by. We can develop same method here as well. We can help them, even though we don't have home center, we can help people with accessories at home. We can teach them. We can tell them people are desperate, family are desperate in knowing what to do with those patients, with their parents. They want to do something for them, but they can't because they are busy, they are working 24/7, moms are working, dads are working. So we have to really be involved in them. We can teach them how to do this. So how we get this? By awareness, having a cognitive center or cognitive clinic, developing multidisciplinary center or multidisciplinary, multi-center specialties, then we can get an excellent center. We had experience on stroke. We have experience in multiple sclerosis, and it took 2 to 3 years for us. And I believe we can get this one as well. And I think dementia is as prevalent as stroke and more prevalent than multiple sclerosis. Why people are not taking care of this? Number one, because companies don't help us with this, right? Because the drugs don't cost so much, and we don't have dedicated doctors to take care of them. We can initiate this as administrators or doctors. So in summary, dementia is an important disease, and it's exponentially growing as our country is aging. The burden to GDP and society is high. Imagine a local patient who is 80-year-old with dementia, not having any caregiver, not being treated, is going between specialties. You cannot avoid sending them back to where they were because they are locals. You have to take care of them. Okay? So we have to have a dedicated center and specialties for those people. And if not now, I mean, we will do it in 20, 30 years' time, or we will be so late if we do it at that time. The UAE is a virgin place to develop because whatever you do, anything you do is an achievement because I see it in a positive way. So we can start doing this. Awareness was the beginning of start, so that's a good start. Now the next step would be having a cognitive clinic. So just accumulate the doctors you have, put them in one place. You will make a cognitive clinic and see how many people will come to you. I bet you will find in no time 3 or 4 months waiting list. By then, if you have developed a multidisciplinary specialty with home care, psychologists, physiotherapists, with patient and family in the core, you will be called an excellence center. Thank you very much.